Hello, I'm Millcreek Township Supervisor John Groh. None of the 5 senses we have should be taken for granted. The sense of sight is one that can diminish during the aging process. Sometimes diseases such as macular degeneration set in, which eventually leads to severe vision loss. To discuss these diseases and conditions of the eyes, along with the services they provide, are my guests Linda Hackshaw and Shannon Wolford of the Sight Center of Northwest Pennsylvania. Ladies, welcome to our program.
Thank you, John. We're very happy to be here.
Well, I'm glad you folks are here too, and we'll talk about the services and different things that go on with the eyes. And I know we have a lot to discuss here in our short time period. So I have some questions I've prepared, and we'll just go right through them there. Okay?
Sounds great, John. Thank you.
Whoever wants to answer, we'll do that. Okay. First of all, somebody give me a history of the Sight Center. The history of how long you've been here and so on. What it's all about. So.
Well, John, I'm older, so I think I'll take that question.
No, you're only 30, right?
I'll take that question, and I've been around for a long time.
Yes.
The history of the Sight Center is a long and interesting one. We were founded in 1938. Believe it or not, we're about to celebrate our 80th anniversary.
Wow.
Yes. So we were founded in 1938 as the Pennsylvania Association for the Blind Erie branch.
Okay.
And we're part of a statewide network of agencies. There are actually today 27 agencies similar to ours that cover all 67 counties in Pennsylvania. So we were founded in 1938. We provided a few services like free white canes to people who were blind and some other assistance with eyeglasses and what have you. Over the years, the agency evolved and became Erie Center for the Blind.
Okay.
Actually, the real name was Erie Center for the Blind and Visually Handicapped. But most people knew us as the Blind Center.
That's a lot to say.
That was a lot of words. Most people knew us as the Blind Center. And I think we went under that name for something like 70 years. And we were located down at 24th and Cherry. In fact, a lot of people knew us as that place on Cherry Street. They didn't even know the name, but that place on Cherry Street.
Yes.
Right, well, that's us.
Okay.
But we're no longer on Cherry Street. In 2010, we changed our name to the Sight Center of Northwest Pennsylvania, and we moved from Cherry Street to West 26th Street. People remember us on the Cherry Street location. We had a sheltered workshop where people who were blind and permanently visually impaired could get sheltered employment. And a lot of people really knew us by that and loved the agency for that. But that program was shut down a number of years ago for a variety of reasons. And the agency has really focused more on vision rehabilitation for people losing their vision and prevention of blindness. And that's really what we focus on now that we're in Millcreek.
Okay, yeah, of course, you're in a really big facility there on the south side of West 26th Street, over near Champion Ford, I believe.
We're right across the street from Bonnell Collision.
Bonnell Collision, yes. So that's what, the 2600 block of West 26th Street? I know it's a big building. I've been to your facility there a couple times just to stop in and say hi or something, and it's big there. So.
It is a big building, but we do an awful lot of services out in the community as well.
Oh yes, I know, and I think when I was talking with you folks, that was where most of the work gets done, is out in the field. You have many people doing that for you. So.
We do. Although it's funny because people mention that a lot about, wow, beautiful building, it's so big. I don't think people understand how many people we actually serve.
Have there. It's just that they're not there all day. They start there and then go out in the field.
Right, or how many people we serve. I mean, believe it or not, we screened over 11,000 children last year in one program alone.
That's just the children that you screened.
Just preschoolers that we screened.
Wow.
Yeah.
Wow.
So
that's an interesting fact. So that, in addition to the services you provide for people that do have vision problems that need your assistance. Wow.
Right.
That's an interesting fact right there. 11,000 children.
Well, I think that's one of the little known facts about the Sight Center is that prevention of blindness is actually half of our business.
Okay.
So we have now a prevention services coordinator. Her name is Lana. And not only does she do the vision screening of small children, but she also runs our diabetes prevention program, which is primarily for adults.
Okay, so we've got a sense of the history of there, and that's very impressive, and 80 years coming up next year. That is great. Let's see here. You could describe the services you guys provide, your folks provide, and how someone watching this program might be able to access those services.
I think I'm going to pass that to Shannon. She's gotten really good at it.
She's really good at this.
All right, I'll chime in a little bit.
And Linda touched on several of those, but when you think about the Sight Center, I like to think about us in kind of 3 categories. And Linda touched on prevention of blindness. And under that umbrella of prevention, she mentioned the vision screening. And she mentioned the fact that we screened over 11,000 children. And by the way, we serve 7 counties.
Right.
Yes,
So
that was something
we're
you
doing
told me
an
after I
awful
read.
lot of vision screening out in the communities where we go into daycares and preschools and community centers and other outreach opportunities where we can get to those children prior to them starting school. So we're working with very young children. And then, as she mentioned, with Lana coming on board as our prevention coordinator, we're running the diabetes prevention program. So that again is a service that not only takes place at the site center, she has some groups there that meet there regularly, but she also takes that program out into the community where the people are. So for example, she's meeting in a church basement. She has a group at a community center. So that's wherever there is the need for that particular service. The second category or bucket of service is our vision rehabilitation services. That's where we have the low vision clinic, and that is something that takes place at the site center every week. As a matter of fact, we've added additional clinic days to meet the need because we had kind of this increase in referrals, and instead of having people on a wait list for months on end, we really wanted to shorten that wait time. We added some additional clinic days. Yes.
Okay.
And in addition to the low vision clinic, vision rehabilitation services are extended to our children as well. So I think the youngest in our care right now is 6
years old.
6 years old, all the way up to young adults.
Right.
And there are a variety of services. We do after-school activities and special types of things. I don't know if you heard, but we had a lot of attention on our Learn to Ski program that took place in the winter.
I did see accounts of that on the news. Yes,
Right,
yes,
so we were very fortunate to be able to put together a program with the help of some board members and other folks in the community that had a real desire and loved the sport of cross-country skiing. And we were able to extend that out to our children's program and teach kids how to ski. I mean, these were kids either who were blind or had a significant visual impairment, and it was really something else to see these kids
It was great.
experience something that they have never tried before.
Okay.
And then the last bucket of service is our specialized support services, and that's everything from transportation. We have a program called Door-Through-Door Transportation Services.
Okay.
And we say it that way because that's exactly
Door-through-door.
what it is. We don't just pull up in the driveway, honk the horn, and wait for the person to come out. We go into the home, we can help you get your code on, make sure you have your medical records if you're going to a doctor's appointment, or, you know, then we get you to the doctor and we take you in and get you registered and complete any paperwork. So it's really that all-encompassing door-through-door transportation. We do grocery shopping, bill paying, mail reading, other life skill training and education.
Okay, so it's more than just eye exams that people might typically think is what you folks have.
Right, and we actually don't do eye exams. I mean, in the low vision clinic, there is an evaluation that we do, but it's not your typical eye exam. And you might want to talk about that because I think
It's called a functional vision evaluation. So someone who comes to us in our low vision clinic already has an eye doctor. They already have a diagnosis. And we're not in the business to take that patient from the eye doctor. We're there to extend what the eye doctor can provide. So if someone is losing their vision, like you mentioned, to macular degeneration, unfortunately the eye physician has to say to their patient, there's no more stronger glasses, there's no surgery, there's no more medicine that we can do. Your vision is declining.
Yes.
But we can help you out by sending you to the site center. And then we take over from there in helping a person learn to use what little vision they may have left to the best advantage to function and continue their activities of daily living.
Well, let me just share a little personal experience, not myself, but my late mother-in-law, who she died a few years back. She was almost 90 years old when she passed away. But when she was in her 70s, it was discovered that she had macular degeneration. And she obtained the services of the site center.
Oh, good. Did she have a great experience?
Yes, she did.
Oh,
actually had a great experience. And actually, one of the things that when she did pass away, we had the clock. There was an audible clock.
Talking clocks.
A talking clock. And if you remember, I brought that back to you folks because the family no longer needed it and figured, why not give it back and maybe it could be used by somebody else.
Right. I'm sure we got it out to somebody else.
And I know that was, and it was a bad day for her. I remember that when she was told that by her eye doctor that, Mary, we're at the end here. There's
Right.
nothing more we can do to
Right.
correct your vision, and so you're going to need to get the help of somebody, of an agency. And he referred her over to the Sight Center.
Right.
So,
That's
Well,
great.
we're always grateful for the referrals, but John,
Yeah.
that also explains why we changed our name.
yes.
If you think about your mother-in-law's experience and she was told, we're at the end, there's nothing more we can do, I'm going to refer you to the Blind Center.
Yes.
That's like a knife in the heart,
Oh,
right?
sure, yeah.
So when we changed our name to the Sight Center,
That's more positive.
it's way more positive.
Yes.
There's a better connotation to that. Like Mary, we're at the end and there's not much more we can do, but those people at the Sight Center can help you.
Right.
I think that it encourages people more to come
think
to
so.
us.
Right.
And once they get through our door, I have to tell you, a lot of people come through our doors, they're very depressed, they're very sad.
Well, I would
they
be too.
do not want to be there. They are devastated by the news that their vision is declining to such a point. We try to make sure that once they get through our door, they feel better almost immediately.
Okay. You guys did do that. The
Thank
agency
you.
did help with that.
Thank
there.
you, I'm
Yeah.
glad. We have a sign right on our receptionist's front desk that says Director of First Impressions.
yes.
And from that
And that is
first
so true.
step through the front door, our goal with everyone who comes to us is to help them feel better about their condition and know that there's hope for them.
Right. Yeah, like I said, I knew how my mother-in-law was about that. She's very upset,
Right.
and my father-in-law too. Here she is, and nothing more they can do to help her with
Right.
her vision. And,
Right. But then they get to us, and there's so much more we can do.
Oh, yes.
We really
and,
can. Like you said,
I
a talking clock can make a big difference
Well, it
if
did.
they know what time of day it
helped
is.
her, and
Yeah.
other visual aids that helped her with living day-to-day
Sure.
living. So.
Exactly.
And that's our goal. And I just wanted to mention, when we have patients come in for low vision clinic, it often can be a very emotional time because,
Right.
as you mentioned, they're coming in, they're feeling a little defeated already.
Right.
Yes.
Like, I can't imagine what these people can do for me now when my doctor has said there's nothing more I can do for you.
Right.
And at the end of that appointment, and it's a long appointment, it takes over an hour, sometimes
Usually
hour
they're
and a
with us
half.
close to 2 hours.
Right.
Yeah.
I mean, we have had people that have shed tears because they're so pleased, and they walk away going, oh my goodness.
It's not the end of life.
I'm going away with a device that's going to help me to be able to read, something that's going to help me continue to cook meals in my own kitchen. They just feel so good and hopeful.
Right.
Yeah.
Yeah, I agree.
Yeah, I think that would be devastating to hear that. Like I said, I told you, about my mother-in-law. As we all age, it's not just the visual things, that anything can happen. And
Right.
I'm approaching that age now where it's going to start with 6, and and although in my mind I'm still 25,
Right.
the body says it's not, and so my flexibility is not what it used to be, and of course I'm a little fatter than I was too. So and those
Why
things
do you
the
talk
doctor.
about that?
Oh, it is very interesting to talk about that, John.
What?
Would you like to say it, or would you like me
Well, go
to?
ahead.
Sorry,
Okay,
and you
everybody-
can add, but the Sight Center recognizes all of those things that you just talked about.
Okay.
And Linda really kind of led this, and we started our new year adopting the theme of wellness in mind, body, and spirit.
Oh.
And really,
I set myself up on this one.
Yeah,
didn't
you
I?
did.
I didn't even know this
that
one.
wasn't even written
It's not even
on the
script.
paper. But she said, I want not only our own staff to be physically and mentally and spiritually well,
Okay.
but I want that for the people that we serve.
Okay.
So, looking at all of those programs that we talked about, and how can we encourage people to look at their own health and wellness, and what can we do to assist them with that?
Right. Because, honestly, John, the truth of the matter is a lot of people say that vision loss is a normal part of aging. Well, I think it's something we accept, but it is not normal. Vision loss as we age is a function of diet and lifestyle frequently. I mean, certainly there's genetic predisposition. There are a lot of
Okay,
reasons
yes.
people lose their
Right.
vision, definitely. But there are a lot of things that we can do to preserve our vision longer and better
Okay.
through changes in diet and wellness.
Okay.
And overall wellness is really a prevention of blindness tactic.
The eyes are just one part of it.
The eyes are just one part of
entire
it.
entire health of the body.
Changes
Absolutely.
in diet and lifestyle are proven to
Okay.
improve and increase the health and longevity of your eyes.
Okay. Well, I hope my wife doesn't watch this show because she's going to tell me, see what those two ladies told you? You should be doing this, you should be doing that.
That's right, that's right.
Well,
But-
wear your sunglasses. That's a great place to start.
Okay, well, I do that.
Protect
one
your
myself.
eyes from UV rays. It's
Okay.
really, it's
I
a
do it
great
just to
place
try
to
to look
start.
cool is why I do it. You know?
Well,
Yes.
you look cool, John.
And safety glasses
Oh,
when you're
definitely
doing things
safety
out in the
glasses. Yes,
yard
what
or
I'm
you're
going to
doing
say.
any
Yeah,
kind of...
Yeah.
Of course, when I'm out riding my motorcycle, I have my goggles on for that
Right.
too. So
That's
yes,
all good.
yeah, safety glasses are very much important there. You don't want to have
Right.
an accident cause blindness.
Right.
So.
Right.
You know, John, another thing that we talk about a lot at the Sight Center besides wellness is participation. And all of our programs, because I did want to just add one thing too. I don't want anyone to think that we have forgotten about our blind clients. And there are people still today who are born blind or are blinded early in life. And our agency isn't just about vision rehabilitation for people losing their vision, but we also care for and very much love our blind clients.
Okay.
And those specialized services that we provide as far as transportation, and we call them chore services, things we can do in the home, and a number of other things are there
Okay.
very specifically for people who are blind.
Okay, let me back up just a minute here or two. When you were talking about 7 counties
Yes.
that you serve,
Want me to list them?
please do. And then I'm going to talk. And I'm going to talk about the how they are. Okay, I know in my
Okay.
experience driving through these counties.
Right.
What counties are we in there?
Erie,
Okay.
Warren, McCain, Jefferson, Cameron, Elk, and Potter counties.
Okay.
We kind of go across that top
Right.
northwest corridor across the top of the
Across
state.
the top of the Alleghenies there. Okay, it's very rural.
You got it.
Well, I used to work in Warren County for a
Okay.
while, and so I know. 2-lane road in, 2-lane road out. It's the only way in there.
Right.
There is no airport to speak of.
Right.
You know, there are landing fields for little Piper Cubs, but
Right.
you know, so it's a big rural area, and it gets more rural the further east you go.
Well, when you get to Cameron, Elk, Potter County, I mean,
There are more
it is-
deer than there are people.
That's
Yes,
exactly
we know
right.
that, so.
Well, we actually have staff members who live in those counties.
Right, yes, I know. Yeah,
Which makes it more convenient to provide services out there. We're not driving all
no, I
the
was
way
going
from
to say
Erie
that.
to Elk.
Yeah, put a lot of miles on the car. that
Right,
way,
and our
so.
primary services in those counties involve transportation. So we're helping people get to the doctor's appointments that they need and to grocery stores and the things that they need. We do our vision screening program out there as much as humanly possible, and then what we call case management. So. For example, we have a gentleman in Warren County, I think Kevin,
I was gonna mention
who
that.
has a lot of health problems. He has MS, and he's basically alone in the world. So while
And he's in Warren County. Wow.
Yeah.
Okay, does he live by himself?
Yes.
Oh.
So we certainly help him with transportation, but there are a lot of other support services that we provide as well, including connecting him with other community resources that help to take care of
So
him.
it's more than just the Sight Center of Northwest Pennsylvania that takes
Yeah.
care. There are other
Right,
agencies,
right.
and of course
Right.
you folks work with them too.
Oh, yeah.
The other
Yeah.
agencies.
We have a lot of
Absolutely.
wonderful
Well,
positive
let's-
partnerships.
Right, that's what I was going to get into next. What the partnerships? I think you mentioned a few of them to me in
Yeah.
prior conversation. What partnerships does the center have? Do we have enough time to talk about all of them? That's the question.
Well, yeah, I don't know. I don't know how much
Okay.
time we have left.
Yeah.
But I would say the Erie Lions Club and all the Lions Clubs in
Right.
District 14F.
Yes.
We have a wonderful relationship with them. They support us throughout the year. I'm sure you know the
Save
Erie
and I
Lions
game.
Club
The
and the
Save
Save
and
and
I
I
game, yes.
and the Save and I Fund.
Yes.
And actually, Linda is a Lion.
I am a lion.
Oh,
That game, of course, is an annual event,
Right.
and it will be coming up in the month of July. So
always
I
does,
hope that
before they-
everyone will mark
before they
their
go out the
calendar
club,
for the
yes.
21st
Right.
of July. That game will be held, I'm pretty sure it'll still be held at the Erie Veterans
Veterans
Memorial
Stadium,
Stadium.
yes, yeah.
Yeah.
okay.
Yeah, we are partnered also with the Bureau of Blindness and Visual Services, which is the state organization for the blind.
Yeah.
With the Veterans Administration, we do a lot of work with vets.
Okay.
Affordable care hearing aid. You know, while people are losing their vision, a lot of them are also losing their hearing, which is kind of a desperate
two-
circumstance, right?
two senses. Oh,
right. We have
no.
a great relationship with Tina at Affordable Care.
Okay.
Embracing Our Veterans is another nonprofit that we work with.
Thank you.
The IU, we're
Yes.
very close with the intermediate unit through the school districts.
Gannon University.
Gannon University.
And
Oh, I'm worried that we're forgetting somebody.
Sure
we
we
really
are.
love our
Bloom
partners.
Collaborative.
Oh,
We've
Stairways,
worked
right.
with Bloom for developing children's
Okay.
programming, so our kids go there and
Okay.
take advantage of some programs that they have to
so
offer.
there are alliances and partnerships formed with other agencies
Absolutely.
and nonprofits, that
Right.
Right. John,
everybody benefits.
we are the only organization in this district doing what we do. And one of the things that we don't want to do is duplicate anything anybody else can do. I would way rather partner with somebody and form a good alliance than duplicate anybody else's
and
efforts.
enhance. So you were talking about the gentleman down in Warren County.
Right.
So there's other agencies, social service
sure.
agencies
Right.
that help this gentleman out.
Right.
Because he has other health problems
Right.
other than the visual problems. that he
Right.
has.
Area agencies on aging are really important to
Okay,
us.
yes. Yeah. I'm sure that's probably where you get many of your clients.
Right.
Is from that.
Right.
Okay, let's see here. I guess one of the, and this may sound kind of like a dumb question, what is the biggest challenge that the Site Center faces? Funding is like many other
Well,
agencies.
sure.
It's kind of a loaded question.
Yeah,
right
sure.
there,
We're
you know,
always
but-
scratching for funding.
So are we at
It's
Millcreek
the-
Township. We're always
right.
scratching for money.
Right. I mean, it's tough all over. It really
Right, it
is.
is.
And we certainly have a strong commitment to sustainability. And it isn't just through fundraising. We do all kinds of things to keep our programming sustainable. That's definitely one of our challenges. I think another one, though, and we talk about this all the time, is being known in the community. In fact, Shannon and I have our own little thing that we say, we're going to get T-shirts. We're going to form a street team wearing our T-shirts that say, know us before you need us.
Okay.
Okay?
That has a nice ring to it.
Know us before you need
Yeah,
us.
know us before you need
You
us.
don't know who or when or how someone is going to need the services of the Site Center. And one of the things we're trying to do, like by being here today, is, Shannon said it in the car today, I don't think that there's a household in this area who doesn't have somebody who may someday need the services of the Site Center. Whether it is preventive screenings for a preschooler, whether it is diabetes prevention programming, or assistance to an elderly family member losing their vision, or assistance to someone who is completely blind.
Yeah.
There are households everywhere that need the services of the Site Center, and they might not know that.
Okay.
So know us before you need us.
That has a good ring to it. Maybe
Thank
you ought to
you.
get the T-shirts made up.
I think we should. You want to be part of our street team?
Boy, sure. Yeah, we'll do that there. Okay. Now, I think in prior conversation, of course, we've had prior conversations, the misnomer about blindness and the definition of what blindness is versus visual impairment.
Right.
Did I have the
Sure.
right term
You
there?
got it.
Can you explain that? Because
Sure.
I did not know that there really was a difference between the two, and I think the public may need to know this too.
I didn't know when I started working there 19 years ago. I really
Okay.
didn't. I think most people envision blindness as pitch black, lights out. And the truth of the matter is there are very few people who suffer from that level of vision loss,
Okay.
where there is no light perception. We know lots of them, believe me,
Okay.
but that is not the norm. The norm is more a loss of functional vision. So for example, macular degeneration,
Yes.
you lose the central vision, which makes reading up close difficult. It might make recognizing a face of a loved one or someone else very difficult because you don't see what's in the middle. But there is this peripheral vision that can be used to function in life. Then you go to the opposite, you've got glaucoma, where you lose the peripheral vision, but you've still got functional vision in the center.
Okay.
So, of course, it's devastating when you've got somebody who has maybe both of those.
Oh, yeah.
They might have a sliver of vision, a crescent of vision. But what we do is figure out what vision a person has left and what we can do to maximize that vision, whether it's through magnification, lighting, special techniques, learning to do things in a different way.
Home modifications.
Yeah.
Home modifications, sure.
And of course, I know one of the things that you folks did over there back in February, I think it was the Media Day.
Right.
And of course, I was invited over there for that. And of course, I mentioned to you that my mother-in-law with the macular degeneration, and you had little places for us to sit down. Just grab a place to sit down, and there was, coffee there, and then you open up a package of glasses, and there were different problems, whatever
Right.
the condition might be.
Vision simulators, we
Vision
love them.
simulators,
Yep.
yeah. And it was a pair of glasses that simulated an eye condition or vision condition. And what would irony have? macular degeneration.
Is that what you got? Yeah.
And I put those on, and of course you wanted us to wear them during your presentation. And I felt immediately like, oh my God, this is the way my mother-in-law had been for so many years.
Right.
But I realized how much more I had to depend on hearing.
Right.
And how annoying it was trying to read with this problem, then looking over at you, and I couldn't see you.
Right.
I could see outlines of you, but I paid more attention to the hearing then. So
It's
that
pretty
was
impactful.
It was. It really kind of shook me up a little bit, because I know then I realized what she went through. So.
Right. And John, you mentioned that opportunity that you had, and that's really why we do our signature fundraising event, Dining in the Dark.
Yes.
It is a dinner.
When is that coming up? Or has
It's
it
in
come
October.
Up?
It's always in October.
So, okay.
And we have blindfolds and vision simulators at the table. We
like-
really encourage our guests to at least try one of the courses of the meal blindfolded or wearing a vision simulator. And some go and do the entire meal.
Yes.
And I think it's interesting, but it makes it difficult first to eat. But even I think it is more difficult for people to have conversation.
Socialize.
To socialize, because you can't tell if someone comes over to you and says something to you, now have they walked away? Are they still there? You've lost all of that ability to read facial cues and just to have that
Body
physical
English,
energy. Yes,
right.
It makes it, and I think that's people really recognize that very quickly.
We have about a minute left in our program. Time has really flown there. Is there anything else that maybe I haven't asked you ladies that you would like to bring up in regards to the Site Center that we need to know about?
I would encourage people to connect with us. We are on Facebook, and we have a website, sitecenternwpa.org.
Okay.
We have an awful lot on our schedule for the 80th anniversary, lots of fun events coming
Okay.
up. So
Good.
give us a call, get on our newsletter mailing list.
Sure.
We'd love to be able to include people.
And of course, you're located at 2545 West 26. We'll have the address at the end of the program
Great.
here. And the phone number is 455-0995.
And John, remember, people need to know us before they need us.
Well, ladies, thank you for being part of our program here today. And to our viewers out there, if you need information, we'll be putting it here somewhere in this program. The contact numbers, if you want to contact us over at the Township building, feel free to do so. We'll be able to get you in the right direction on that there. Thanks for watching our program today.
You're watching the Millcreek Government Channel, powered by WQLN Public Media.